Well, in the couple of weeks, we've been really debating with medical advisors. Now, we formed the Advisory Council of Experts, of which Ron Jean Solante has been part of it, that Herbosa, Michael T., and so many of the best doctors who experienced this pandemic, especially in the first 2 years. No? So we've come to certain conclusions, and we've sent our letter to President Marcos on our recommendation, and hoping that he would grant an audience with the group of ACE. Dr. Rogin Solante is correct. I mean, you have basically some level of complacency out there right now. But nevertheless, I think we should remain focused on our approach. And that's why we have recommended a simplified alert coding, using the stoplight, green, yellow, and red, basically focused on ADAR and HCUR. And these are the base. It simplifies the whole process, whereby greater transparency is seen, why we are in green, why we will be in yellow, and why we are in red. So, and these are basically all agreed by the Advisory Council of Experts. So, and there is also a provision where outdoor masking can be lifted, whereby 70% of those who have taken the primary doses, have to have the first booster shot. If we were to look at it where we are right now, we're very far from that. So it's a challenge to really get up to 70% of those who have taken the primary doses to get the first booster shot, and that is very important. Dr. Solante even emphasizes the waning immunity.
Sir, very quick and very basic follow-up by way of giving background also. I don't know if people caught that. ACE is the acronym. It refers to the Advisory Council of Experts. What's the nature of ACE? Is this purely a private sector, civil society?
Yes.
Okay.
So what we did is we got the best doctors who were with us in the pandemic, since we had a public-private partnership, and we worked with Octa Research. We worked with the best doctors out there. Some of them are part of IATF, NTF, and the most important is to prevent lockdowns, and that's the private sector's fear. How do we prevent lockdowns, and how do we manage this? And bottom line is healthcare utilization rate is the most important. So anything above 50% will take you to red. Anything below 50% will keep you within green and yellow. So we have to prevent the HCUR from going beyond 50%. Initially, I was saying, why don't we make it 60%? But the doctors were very conservative to keeping it at 50%. Because when you see hospitals, people dying, emergency rooms getting full, they don't want to see that happen. So this is what we agreed with them. And when the private sector makes recommendations, I felt it's very important to be backed by science. And what best is not to get the best out there who have really gone through the battlefield for the last 1 year, 2 years already, and advise the private sector on how we can prevent lockdowns. And this is what we are doing right now.
Mr. Concepcion, you originally recommended the redefinition of a vaccinated person to include the first booster shot. And now Dr. Solante mentioned vaccine complacency. Are you going to push again for this redefinition, or do you have other suggestions to overcome vaccine complacency?
Well, of course, we want to see that the definition of a fully vaccinated person includes the primary doses and the first booster shot. I think the doctors are unanimous when it comes to this. But then again, I mean, we can't implement vaccine mandates because there's no such. Secretary Maynard Guevara at that time said it was not legal to do that, so they abandoned the no vax, no ride, and all of these other things. We cannot tell our employees again to take the RT-PCR test at their expense because they're not vaccinated. So yes, complacency is there. Now, we will try to do a campaign in the coming weeks to encourage, but the attention really is towards the LGU, and that's why I've set a meeting with Secretary Albalos, that how can the private sector partner with the LGUs to really campaign so that our citizens really focus on taking at least one booster shot, not the first booster shot. And I think that's what the president wants to see. So our goal is just 70% of those who have taken the primary doses. No? Right now, the number of people that took the primary doses is about 74, thereabout, 74, 75%. So we're saying let's target 70%. Where are we right now? We're just maybe in the 20% levels. No, I got the table from DOH, and they range between 14. So it's very, very low. So if and then we reward the regions that attain these levels by allowing them to have the removal of face masks on outdoors if they achieve this. But believe me, achieving this is not, it's a tall order. No?